Ever wondered what causes that unsettling gastrointestinal bleeding? Well, you're about to find out. Gastrointestinal bleeding, or GI bleeding as it's commonly known, is a symptom of many conditions rather than a disease itself. It's a signal from your body that something is not quite right within your digestive tract, which, might I add, is an impressive system that extends all the way from your mouth to your anus. The bleeding can occur anywhere along this path, and depending on where it originates, it's categorized as either upper or lower GI bleeding. Now, you might be thinking, why should I care about gastrointestinal bleeding? Well, aside from the fact that it's a rather uncomfortable experience, it's also a common and potentially life-threatening condition. It can occur suddenly or slowly over time, and the severity can range from mild to severe. The bleeding can be so slow that it's hard to notice, or so severe that it can cause shock. Either way, it's not something to be ignored. Understanding gastrointestinal bleeding is crucial, not just for those in the medical field, but for everyone. It's like understanding the warning lights on your car's dashboard. Just as you wouldn't ignore a flashing check engine light, you shouldn't ignore the signs of gastrointestinal bleeding. The sooner you recognize the symptoms, the sooner you can seek help and prevent further complications. For medical students, this is a vital topic. You'll encounter patients with gastrointestinal bleeding throughout your career, and understanding the causes, symptoms, and treatment options is key to providing effective care. But this isn't just for future doctors. Health-conscious individuals, this is for you too. Understanding your body and how it communicates with you is an integral part of maintaining your health. So, whether you're studying medicine or you're just curious about your body's inner workings, understanding gastrointestinal bleeding is a step in the right direction. It's a complex topic, but don't worry, we're going to break it down and make it digestible, pun intended. Stay tuned as we delve deeper into this subject and unravel the common causes of gastrointestinal bleeding. Let's start from the top, shall we? The upper gastrointestinal tract. We're talking about everything from your mouth to the point where your small intestine begins. This includes your esophagus, stomach, and the first part of your small intestine, known as the duodenum. Now, each of these areas can become a source of bleeding, and the causes can vary. One of the most common culprits of upper gastrointestinal bleeding is peptic ulcers. These are sores that develop on the lining of your stomach, upper small intestine, or esophagus. They form when the protective mucus that lines these organs is reduced, allowing the acidic digestive juices to damage the tissue underneath. Factors such as long-term use of non-steroidal anti-inflammatory drugs and infection with the bacterium Helicobacter pylori can contribute to this condition. Next, there's gastritis. It's an inflammation, irritation, or erosion of the stomach lining, and it can occur suddenly or gradually. Just like peptic ulcers, it can be caused by excessive alcohol use, chronic vomiting, stress, or the use of certain medications. But there's also a type of gastritis that occurs when you're stumming your stomach linings or weakens with age or due to a chronic condition. Then we have esophageal varices, which are abnormally enlarged veins in the lower part of your esophagus. They're often associated with serious liver diseases, as the conditions can cause high blood pressure in your portal vein, the large vein that brings blood from your intestine to your liver. So, while these are some of the common causes, it's important to remember that upper gastrointestinal bleeding can also be caused by other factors, like a tear in the esophagus due to violent vomiting, known as Mallory-Weiss syndrome, or a condition called Dieulafoy's lesion, which is an abnormally large artery that causes bleeding in the stomach. So the upper gastrointestinal tract can be a source of bleeding, but what about the lower part? Let's explore. Moving on down, we find another potential hotspot for bleeding, the lower gastrointestinal tract. This part of our digestive system, which includes the large intestine and rectum, can also be a source of significant bleeding. One common cause of lower gastrointestinal bleeding is diverticular disease. This condition occurs when small, bulging pouches, known as diverticula, develop in the digestive tract's lining. When these pouches become inflamed or infected, it can lead to diverticulitis, causing abdominal pain, fever, and yes, gastrointestinal bleeding. Now let's talk about something we often joke about, but is no laughing matter when it comes to gastrointestinal bleeding, hemorrhoids. These swollen blood vessels in the rectum or anus can rupture and bleed, often resulting in bright red blood on toilet paper or in the toilet bowl. While hemorrhoids are typically not dangerous, they can be quite uncomfortable and can cause significant bleeding if left untreated. Then we have colorectal cancer, a more serious cause of lower gastrointestinal bleeding. This form of cancer, which affects the colon or rectum, often starts as small, non-cancerous clumps of cells called polyps. Over time, some of these polyps can become colorectal cancers. One of the early warning signs of colorectal cancer can be gastrointestinal bleeding, making it crucial to investigate any unexplained bleeding. As with upper gastrointestinal bleeding, it's important to note that not all lower gastrointestinal bleeding is visible. Sometimes the bleeding can be slow, leading to blood in the stool that's not noticeable without testing. This is known as occult bleeding and can lead to anemia if it persists over time. Those are the main culprits in the lower gastrointestinal tract. But are there other causes we should be aware of? We've covered the upper and lower gastrointestinal tracts, but there's more to it than just that. While we've discussed the common causes of gastrointestinal bleeding, there are other less common factors to consider. Medication side effects, rare tumors, and vascular malformations can also lead to gastrointestinal bleeding. Let's start with medication. Certain drugs, such as aspirin and other non-steroidal anti-inflammatory drugs, or NSAIDs, can irritate the stomach lining and cause bleeding. Blood thinners, as their name suggests, thin the blood and can lead to bleeding as well. If you're taking these medications and notice signs of gastrointestinal bleeding, it's crucial to inform your healthcare provider. Next up, let's talk about rare tumors. Though not as common, tumors in the stomach, small intestine, or colon can lead to gastrointestinal bleeding. These tumors can be benign or non-cancerous, but even then, they can cause significant bleeding. Malignant or cancerous tumors can also cause gastrointestinal bleeding as they grow and invade the surrounding tissues. Last but not least, vascular malformations might be a culprit. These are abnormal clusters of blood vessels that can develop anywhere in the body, including the gastrointestinal tract. They can range from tiny, superficial lesions to larger, deeper ones. These malformations can bleed, especially if they're in the gastrointestinal tract. So while upper and lower gastrointestinal bleeding is often due to ulcers or hemorrhoids, we should not overlook these other causes. Each has different implications for treatment and management, making it crucial to identify the exact cause of the bleeding. Remember, gastrointestinal bleeding is not a condition to take lightly. It's a symptom of an underlying issue that needs medical attention. If you're experiencing any signs of gastrointestinal bleeding, seek medical help immediately. Now that we know the causes, it's important to understand what signs to look out for. Don't worry, we'll cover that in the next part of this discussion. Stay tuned to learn more about the symptoms and signs of gastrointestinal bleeding. Identifying gastrointestinal bleeding early can be life-saving, but what should you be looking for? When it comes to gastrointestinal bleeding, there are several signs and symptoms that can provide clues. Some are obvious, like spotting blood in your stool. This is often a clear indication that somewhere along your digestive tract, there's a bleed. The blood can appear bright red, or sometimes it might be so dark it's almost black. Now, not all blood is visible to the naked eye. Occult or hidden blood might be present in your stool, and you wouldn't know it unless a specific test was performed. This is why regular screenings are so important, especially as we age. Another sign to watch out for is a change in the color and consistency of your stool. If it's black and tarry, it might indicate that there's bleeding in the upper part of your gastrointestinal tract. This is because as the blood travels down your digestive system, it gets broken down and turns black. Abdominal pain is another common symptom. It's often described as a gnawing or burning sensation in the stomach area. It can be constant or it might come and go. Feeling weak, lightheaded, or dizzy can also suggest that you're losing blood. You might even notice that your heart is beating faster than usual. These are signs of anemia, a condition where your body doesn't have enough red blood cells to carry oxygen to your tissues. Don't forget about vomiting. If you're throwing up blood or something that looks like coffee grounds, it might mean that there's bleeding in your stomach or esophagus. Lastly, unexplained weight loss or decreased appetite could be a sign of chronic gastrointestinal bleeding, although these symptoms are often associated with other conditions as well. It's important to remember that these symptoms can vary widely from person to person. They can also occur in many other conditions, not just gastrointestinal bleeding. So, if you notice any of these signs, it's crucial to seek medical attention right away. Recognizing these signs can lead to early detection and treatment. But how exactly do physicians diagnose this condition? Diagnosing gastrointestinal bleeding involves a range of tests and procedures. Let's go through them. As we delve into the realm of diagnostics, it's important to understand that the methods used can vary depending on whether the bleeding is in the upper or lower gastrointestinal tract. Starting with the upper gastrointestinal bleeding, an endoscopy is commonly used. This procedure involves a small flexible tube with a camera on the end, known as an endoscope, being passed down the throat into the stomach and duodenum. This allows the doctor to visualize the internal space and potentially identify the source of the bleeding. Colonoscopy, on the other hand, is the preferred diagnostic tool for lower gastrointestinal bleeding. In a similar vein to endoscopy, a long flexible tube with a camera, called a colonoscope, is used. But this time, it's inserted through the rectum and into the colon. This procedure allows physicians to examine the entire length of the large intestine and even take small tissue samples or biopsies if necessary. But what if the bleeding is elusive and not easily spotted with an endoscope or colonoscope? That's where imaging tests come into play. Techniques like computerized tomography or CT scans and angiography can provide a detailed view of the gastrointestinal tract, helping to pinpoint less obvious sources of bleeding. A CT scan uses a series of X-ray images taken from different angles and computer processing to create cross-sectional images of the bones, blood vessels, and soft tissues inside your body. This can reveal abnormalities that may be causing bleeding. Angiography, on the other hand, is a procedure that uses X-rays to view your body's blood vessels. During an angiography, a dye is injected into your bloodstream, and a series of X-rays are taken to locate the bleeding vessel. These diagnostic techniques, along with a thorough clinical history and physical examination, play a crucial role in diagnosing gastrointestinal bleeding. So we've identified and diagnosed gastrointestinal bleeding. But what happens next? After diagnosis, the next step is treatment. But what does this entail? Treating gastrointestinal bleeding is a multifaceted process. It can range from simple medication to more complex procedures, depending on the severity and cause of the bleeding. It's important to bear in mind that the goal is to manage and hopefully stop the bleeding. Let's start with medications. Doctors often prescribe drugs such as proton pump inhibitors to reduce stomach acid production. This helps in cases where ulcers are the cause of the bleeding. Another common medication is a type of antibiotic, which helps eradicate bacteria like H. pylori, known to cause stomach ulcers. If the bleeding is due to inflammation, corticosteroids might be used to reduce the inflammation and prevent further damage. It's like putting out a fire before it can spread. In some cases, doctors may use endoscopic therapy. This involves a thin tube with a camera being inserted into the body. The doctor can then directly view the bleeding site and use various techniques to stop the bleeding. This could be through the use of clips to seal off bleeding vessels, or even cauterization, which is essentially burning the tissue to stop the bleeding. In more severe cases, surgery may be necessary. This could involve removing a part of the stomach or intestine where the bleeding is occurring. It's a last resort, but sometimes it's the only option to save a life. Blood transfusions are also a common treatment method, especially in cases of severe blood loss. This helps to replenish the body's blood supply and maintain the patient's stability. After treatment, it's crucial to monitor the patient's progress closely. This is to ensure that the bleeding has stopped and that no complications have arisen. In all these treatment approaches, it's important to remember that every patient is unique. What works for one may not work for another. Therefore, doctors often tailor the treatment plan to the individual patient, taking into consideration their overall health, the cause of the bleeding, and the severity of the condition. Treatment helps manage and hopefully stop the bleeding. But remember, early detection is key. We've covered a lot of ground today, haven't we? We began our journey exploring the daunting world of gastrointestinal bleeding, delving into the intricacies of both upper and lower gastrointestinal bleeding. We've learned that these conditions can be caused by a multitude of factors, from peptic ulcers to diverticular disease, and even certain medications. We then navigated through the signs and symptoms of gastrointestinal bleeding. We discovered that they can range from the overt, like blood in the stool, to the subtle, like fatigue and shortness of breath. Our voyage also took us through the process of diagnosing this condition. We explored how healthcare professionals employ a combination of physical exams, laboratory tests, and imaging studies to reach a definitive diagnosis. Finally, we studied the various treatment options available, which are as diverse as the causes and can range from medication to surgery. Thank you for joining us on this deep dive into gastrointestinal bleeding. Remember, knowledge is the first step towards better health.